ahead. And all right. So what is medical appraisal? It is best appraisal is basically an annual meeting between a doctor and a colleague who is trained as an appraiser. So actually, I was thinking before my appraisal, like it's a kind of exam, or they are going to judge me on some things, and if I have not done few things, then they may be, I might be in trouble. That was in my mind. For example, there are different types of mandatory trainings. You have to do them while you are working, and with the full-time job sometimes you are not able to do all of them because there are a lot of them, and you are supposed to do them, but with the job sometimes it's not possible to do them within the standard time. So I was little bit worried what will happen if I'm going to my appraisal without all those stuff. I'm supposed to do this and that and blah blah blah. But actually my real experience was really nice. It was a formal meeting. It was a video meeting with my appraiser. We discussed about my mag form. I will tell you shortly what a mag form is and what you are expected to do, how you are supposed to fill that form. And we had a meeting, and then we discussed about each and everything, whatever I have written in my mag form. We discussed about that, whether it was my personal development plan, whether it was about my CPD points, whatever I have written. I will show it to you shortly. And then after that meeting, we have to come up with a plan. We call it a PDP plan or a personal development plan. It can be anything. It should be a mutual plan between you and your appraiser. For example, if you have joined your job just recently, say for example 6 months back, so they are not expecting you to do a lot of things in this time, especially if it is your first appraisal. It's not that formal for your next appraisals, because you have previous personal development plan, professional development plan, and you have to meet the criteria whatever is listed in that professional development plan. But in your first meeting, since you don't have anything, so it's okay. Even if you have done just the average amount of learning, and even if you are not having any colleague feedback or patient feedback kind of thing, it should be fine. Some other things are mandatory, you have to do them, but you don't have to worry a lot about these feedback stuff and these training kind of things. So you will discuss with your appraiser about your stuff, whatever you have done, what you are expecting to do in next year, and then in your PDP plan you will write it down. For example, if you want to go for a training, you can write it down in your PDP plan, how you are expected to achieve that training. You will write it down. For example, if you are planning to appear in GP training, okay, that is your plan for next year. Second thing, they usually ask you what you are expected to do for that. So there is an exam, and you have to prepare for the exam, and you have to meet the criteria for that NTN, national training number. You have to meet the criteria for that. And minimum, they will ask you the minimum duration, and then you have 1 year as a minimum duration for that. And there are other things. For example, it can be an ALS. For example, if you have joined just recently and you have not done your ALS, so it can be your PDP plan that I want to complete my resuscitation, advanced resuscitation. Or if you have not done BLS, you can put that in your PDP plan. If you are aiming for any master's degree, for example master's in public health or any other thing, then you can put that in your PDP plan. You don't have to put a lot of things there, because by the end of next year you are expected to complete those things. But at the same time, if you have not done a specific thing and you have a valid reason for that, for example you were on maternity and you couldn't do that thing, then it should be fine. And then next year you can discuss with your appraiser, and then next year you can complete that thing. For example, if my PDP plan was to enter in the training and I couldn't do that because of certain reason, I was not able to do the exam, or I failed the exam, or whatever the reason is, and next appraiser meeting I can be honest about it, and then we can come up with a next PDP plan. So it should be fine. And your appraisers are mostly trained in this stuff, so you don't have to worry a lot about it. My appraiser was really good, and he guided me a lot about all this stuff. Okay, so the timeline for appraiser is, you have to do it between 1st April to 31st March. So once you have got your GMC registration, the next thing is to get a designated body. And how you are going to get the designated body? By finding a job. If you have found a job, you will put that hospital in your designated body. There will be a person in that hospital who will be looking after your appraisals and revalidation kind of stuff. Along with that, once you have an appraiser, everybody is bound to do an appraisal at least, in a year. But sometimes, due to some circumstances, for example, due to COVID, people were not having appraiser because of so many reasons. So their appraisal process was delayed or stopped for a short duration of time. So normally you should be doing one appraisal in a year, but if you are doing it in 1.5 year, it should be fine. Sometimes if you have a valid reason to delay that, you can discuss it with your appraisal revalidation team of your hospital. And if you have a valid reason, then it should be fine. So this is appraisal. And revalidation is done every 5 years. Both of them are different things. Appraisal is something that you have to do annually. You have to do one appraisal per year, and revalidation is something you have to do every 5 years. Uh, both of both these things are very important for us. Uh, it is a part of good medical practice, so you have to do it. But there are certain things that are important for revalidation, and they are not that important for appraisal. And especially it is first appraisal, then you don't have to worry about those things. I will discuss that thing with you. For example, one of them is feedback, colleague feedback, patient feedback. So it is your responsibility to find a designated body and involve in the activity of appraisal. It's not your hospital's responsibility or anybody else's responsibility to do that for you. It's your responsibility, because you have registration, GMC registration, and you have to find somebody who can do appraisal with you. So once you have joined the trust, you have to put that as your designated body. Most of the time, like for me, they contacted me and they told me who my appraiser is. But if they are not contacting you, and it is, you are by the end of your next year and now appraisal is due, so you should be in touch with them and ask them about when is your appraisal due, who is your appraiser, and you should be arranging that with them. So in order to prepare for appraisal, there are certain things you need to do. First of all, a MAG form. You must be having an idea about Horus portfolio. It is a portfolio used in UK for foundation trainees. So you have to put your case presentations, you have to put your developmental needs, you have to put your mandatory trainings, you have to put your teaching, everything in that form. MAG form is just like that, but it is specifically designed for appraisal. So whatever is in the MAG form will be discussed in your appraisal meeting. I will show you shortly what a MAG form looks like. And then you have to book a meeting with the appraiser. Once you have filled out your MAG form, you have to book a meeting with your appraiser. You have to send this MAG form to them before the meeting so that they can have a look at it. And then you will have a meeting. In the meeting, you will discuss about your different things. They will correct you. If you have not done something in a right way, they will tell you about that. You can edit it. You have to complete the plan form. And then during that meeting, you will come up with a PDP plan with your appraiser. You have to write it down in your appraiser. And can you please mute yourself? Okay. And then After you have filled out the form, you have written down your PDP plan. If there are any corrections, you need to do that and then send this form back to your appraiser. He will write down comments for you. He will give the feedback section. I will show you where you are going to write in the form and where your appraiser is going to write in your form. There are different sections. So he will write down his comments and then he will send it back to you. You can, then once the form is with you, finally now you can lock the form and then send it back to your appraisal team in the hospital. And this is appraisal process. Now the process is complete. After you have sent your final locked form to them, they will give you an appraisal feedback form. You have to fill out the feedback form. It's basically for them. They will know how to improve them for next appraisals, and it will help hospital to improve their appraisal activity. So this is a process that you have to do for appraisal. Okay, so when you are talking about appraisals, there are different sections you have to do in that. So for example, first one is your profile. You have to write down your name, GMC number and everything, details, address, etc. And then your detailed scope of work. For example, if you are working in medicine, you are working in surgery, what is your grade? What are your professional responsibilities? Your job plan, and then you have to certify that you are fit to work, you are not having any health issues or anything. If there are, then you can mention that. And you will not be judged based on any health problems or anything, but you have to be honest about it. Next thing is that 360 colleague and patient. What is this? It is basically a feedback from your colleagues and patients. You don't necessarily have to do it in your first appraisal, but you have to complete this in your 5-year cycles of revalidation. Even if you are not having it in first one, second one, if you can get something about it, it will be great. But at least by the end of 5 years, you should be having these feedback forms. Currently, I will not touch this part because it was my first appraisal and I'm not having exact idea what it looks like or what it is. But once I will do it for myself, then I will share it with you guys, what you have to do in that. Next thing is about private practice. Normally with the license we are having, it is usually with APS restriction. So we can't do private practice. We have to do it in approved clinical setting. So I don't think it will imply, but still if somebody is doing any private practice using your license, you have to declare that here. Next comes a complaints. If there are any complaints against you, for that, in my hospital, I asked them and they advised me to send email to the complaint department of the hospital, and then they sent a letter back to me stating that I'm not having any complaints during this time. So ask your appraisal team in the hospital, and then you will be getting a certificate for that there are no complaints. And if there is any complaint, don't have to worry about that. If there is anything, then you have to write a reflection on it. I will show you what to do about that in next slide. And then CPD points. Your CPD points. Normally you are expected to have around 50 CPD points, but for first appraisal, 40 to 50 should be fine, depends on your appraiser. And you have to show proof of those CPD points. For some of them, you will not be having any proof. For example, I will tell you what includes CPD, and then I will cover this part in next slides. Okay, then I will tell you what to do about that. Next part is significant incidents. If there are any significant incidents, exception, significant incident is incident reporting. If there was anything, you were involved in anything, then you can mention that. PDP is your professional development plan. As I mentioned earlier, you have to come up with a plan during your appraisal meeting with your appraiser. If you have something in your mind, you can write it down for yourself so that you can discuss it with your appraiser during the meeting. Then comes your quality improvement and audits, which is a very good practice to be involved in some audits and quality improvement project. It's good for your portfolio, it's good for your appraiser. But in your first appraiser, if you have nothing, it is fine, as long as you are, being in touch with your department regarding some like quality improvement projects are not only audits or QIPs. Your mortality morbidity meeting, your MDT meeting, your departmental teaching sessions, all these things are quality improvement things. So even if you have not done any formal audit, or you are in the beginning of an audit, you can mention that. Or if you don't have any audit, still you can mention about these things. Then comes your mandatory trainings. And if you have not done all of them, you should be doing some of them. It shouldn't be a blank thing. If you have not done all of them, then there is a declaration. For example, if there is an outstanding training, you were supposed to do this training by the end of March, but you have not done it so far because of so reason, then you need to write down a declaration. Normally, when your hospital emails you about this appraisal stuff, they will give you a declaration as well. So if there is any outstanding training, you need to fill out that declaration, and then you can write it down that I'm expected to complete this training. For example, if you have, for example, end of life training, it is a mandatory training, or blood transfusion training, these kind of training. If you have booked it, for example, in June, then you can mention the date you have booked it, and then you have to sign that declaration. Okay. So as we mentioned earlier about complaints and significant event, if you have anything, because you never know if there is any complaint or any incident reporting, and you were involved in that, you don't have to worry a lot about it if it's not, something serious. Having said that, please have your indemnity insurance with you so that they can protect you if something like this is happening. It is mandatory for us. It's very important. So get indemnity insurance, and if there is anything on your name, then you can write a reflection on it. How to write a reflection? Tell the situation. How did you feel about it? What happened exactly? And then how you could have done something that could have saved that thing. Let's discuss a hypothetical example. For example, simple example can be like, patient was penicillin allergic, and he was about to have the penicillin. And for example, you are the doctor who has prescribed penicillin to him, but he was about to have the penicillin. Nurse in charge has seen it, and then she has incident reported it because you have prescribed it wrongly. So first of all, you should be checking the allergies before prescribing. But even if you have done that, you can tell the situation, that whole situation, that what happened during that time, why it happened. For example, you were having workload, you were busy at that time, and then what you would have done in order to prevent that. For example, you would have checked the allergy status of the patient. If it is not mentioned in the drug chart, it can be in the patient's previous records, history, or anywhere. So you should have made sure that patient is not penicillin allergic. Along with that, you could have asked the patient, and what did you learn and how will you implement this in the future? So if you have any strategy in future for that, for example, it was your first time, maybe first week in NHS, patient was penicillin allergic, and somebody asked you to prescribe it, and you prescribed it, and you did not check any allergy status of the patient. So they have incident reported it, but patient has not received it. So it was a kind of near miss. There was no significant harm done, but because you prescribed it without checking, so maybe it was an incident. So in the future, what you will do, you will check allergy status of the patient. You will check the wristband, because mostly allergies if they are having any allergies, they are having wristband. Check wristband, ask the patient. So in the future, always make sure you are doing this stuff. And while you are writing all these things, you should be omitting any identifiable information. You should not be mentioning patient name or hospital number or NHS number or anything like that. You should be maintaining patient confidentiality. Whatever you are writing on your portfolio, whatever thing, whether it is a mortality, morbidity meeting or whatever it is, you should be maintaining confidentiality. It's very important. Now, this is how MAC form look like. I will be opening the form and sharing it with you guys shortly. But before that, as we discussed earlier about CPD activities, what are CPD activities? Because this is the most important question in our mind. It was the most important question in my mind as well. What I can include in these CPD activities? CPD activities can be anything. Departmental teachings, meetings, like a formal meeting. Every department has mortality, morbidity meeting once in a month or twice in a month. They have MDD discussions. You can mention them. You can write down the title of the teaching. And then in the reflection part, you can write down what did you learn from that. For example, if you have attended any teaching session on acute chest pain scenarios, then you can write down in the reflection that what you have learned. Like, for example, you have learned to manage patient coming with chest pain in emergency. And if there is any specific, any interesting thing you have noticed in that case, you can comment on that. It shouldn't be so long, but at least it should reflect that you have learned something from that teaching. And plus, you don't have to write it down for each and every teaching. Or each and every morbidity mortality meeting. You can pick up a case or two cases and then you can talk about, and you can write about that. If you have attended any conferences, workshops in your hospital, outside your hospital, not necessarily it should be when you got the job. Since you have got GMC registration, whatever you have done so far, you can include that in your CPD activities. If you have done any trainings, any teachings, you have done any ALS, BLS kind of stuff, you have done online modules, there are different sources for that. And this is an other important questions by many colleagues, that how we are supposed to do these online courses, how we are going to get CPD activities. Different resources, for example, if you are employed, you can use ELFH. It's a very good resource, e-learning. And then you can use Medscape. There are short modules as well that will give you 1 or 2 CPD points. You can do some modules on doctors.net, Coursera, and I think BMJ. So even if you are reading some journals, you are doing some research, you can include all these activities in your CPD activities. If you have attended any audit meeting in your hospital, you have attended somebody else's audit, you can write it down in your CPD. Along with that, you can write down about that audit in the QIP as well, as a reflection that you have learned something from that audit, and you are thinking, or you might be doing an audit, but that audit taught you this thing. Quality improvement audits activities, as we already discussed, it doesn't only include audits and QIPs. It can include your research, publication, mortality, morbidity meetings, MDD discussions, your departmental teachings, all the mandatory teachings as well.